Did you know that regular ejaculation might actually support a healthier prostate? It sounds surprising, especially considering how much misinformation floats around. But according to growing scientific evidence, men who ejaculate more frequently, whether through sex or masturbation, may have a lower risk of developing prostate cancer. That one simple fact has sparked a lot of questions and curiosity. Could something as common as masturbation really be good for your health? Could something most men do anyway actually help protect one of the most vital parts of their reproductive system? Today, we're going to talk openly about what happens to your prostate if you masturbate daily. No shame, no taboos, just honest, science-based information. We'll explore what the research actually says, clear up the myths, and help you understand what's fact, what's fiction, and what it all means for your health as a man. First, let's talk about the prostate. The prostate is a small gland about the size of a walnut sitting just below your bladder. It wraps around your urethra, the tube you pee through. But it's not just there for decoration. It has a big job to do. Your prostate produces most of the fluid that makes up semen. This fluid protects and nourishes sperm. So, in simple terms, it plays a central role in male fertility and sexual function. But as men get older, the prostate often becomes a source of concern. It's prone to conditions like benign prostatic hyperplasia, BPH, an enlarged prostate that can cause frequent urination or difficulty emptying the bladder; prostatitis, inflammation of the prostate, which can be painful or uncomfortable; and the most serious concern, prostate cancer. That's why taking care of your prostate isn't just a side note. It's an essential part of overall health, especially as you hit your 40s, 50s, and beyond. Where does ejaculation come in? Now, let's get back to the big question. Does masturbating daily affect your prostate? Well, researchers have been digging into that for years, and a pattern has started to emerge. Multiple studies suggest that frequent ejaculation might lower the risk of prostate problems, particularly prostate cancer. How? One theory is that ejaculation helps flush out substances that can build up in the prostate. This includes potentially harmful compounds like toxins or inflammatory agents that, if left to sit too long, might irritate or damage prostate tissue. Regular ejaculation may act as a natural cleaning system, keeping things moving and preventing stagnation inside the gland. It's a bit like changing the oil in your car. You're not fixing a problem. You're helping prevent one. Masturbation, a natural part of male health. Before we go further, let's clear the air on something. Masturbation is normal. Almost every man does it, and the vast majority do it regularly. It's not dirty, it's not dangerous, and in most cases, it's not something to feel embarrassed or guilty about. Unfortunately, a lot of men still grow up hearing messages that make masturbation feel wrong, shameful, or harmful. These outdated ideas have been passed down through generations, and they've done real damage, but science tells a different story. Masturbation can offer many benefits. It can help relieve stress. It promotes better sleep. It improves mood. And for many men, it helps maintain a healthy sexual function. So when we're talking about masturbation and prostate health, we're really looking at a much larger picture of physical and emotional wellness. The big study that got everyone's attention. One of the most talked about studies on this topic came from researchers at Harvard University. They followed over 30,000 men for nearly 2 decades. Their findings? Men who ejaculated 21 times per month or more had a significantly lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. That's about 5 times a week, or, yes, roughly once per day. This was one of the first large-scale studies to make that connection. And since then, more studies have supported the idea that ejaculation frequency might have a protective effect. So what's going on inside the body that makes this happen? How ejaculation may help the prostate. Scientists believe ejaculation might benefit the prostate in several ways. Flushing out toxins. Seminal fluid can collect toxins, waste materials, and other unwanted substances over time. Regular release might reduce their buildup inside the prostate. Reducing inflammation. Chronic inflammation is a known contributor to prostate issues. Regular ejaculation might help reduce inflammatory markers in the gland. Improving circulation. Just like exercise helps your heart, ejaculation may improve blood flow and tissue health in the pelvic area. Balancing hormones. Some researchers think frequent ejaculation may help regulate levels of certain hormones, including those that affect prostate tissue growth. Can you overdo it? Here's where the conversation gets more nuanced. While moderate daily masturbation can be healthy, going overboard can lead to temporary issues like prostate tenderness, mild irritation or swelling, discomfort when urinating, a feeling of heaviness or pressure. But, and this is important, these symptoms are usually short-lived and don't lead to long-term damage. There's no evidence that daily masturbation causes serious prostate problems. But if you're masturbating compulsively to the point where it interferes with your daily life, relationships, or emotional health, that's a different story. That's not about prostate health. That's about balance and mental well-being. What about prostate infections or pain? Some men report prostate pain after frequent ejaculation. This could be due to temporary inflammation or a condition called prostatitis. Prostatitis can sometimes be triggered by extended periods of sexual activity or even long periods of no activity at all. But in most cases, prostatitis isn't caused by masturbation. And when it does flare up, it's often treatable with rest, hydration, and, in some cases, antibiotics or anti-inflammatory medications. So again, the key takeaway is balance. Listen to your body. If something feels off, talk to your doctor. But don't assume that daily masturbation is the root cause. Breaking down more myths. Let's knock out some of the most common myths about masturbation and prostate health. Myth number 1. Daily masturbation drains testosterone. Not true. Ejaculation has a minor short-term dip in testosterone, but your levels bounce back quickly. Masturbation doesn't cause long-term hormonal imbalance. Myth number 2, masturbation leads to infertility. Nope. In fact, it helps keep your reproductive system working by keeping fluids and sperm moving regularly. Myth number 3, too much masturbation shrinks your prostate. There's no solid evidence for this. In fact, many studies suggest that it may reduce inflammation, not shrink the organ unnaturally. Myth number 4, you should save sperm to be healthy. False. There's no medical reason to avoid ejaculation for health benefits unless advised by your doctor. The mental and emotional side. Let's not ignore the psychological benefits. Masturbation can be a form of stress relief, a way to connect with your own body, a safe way to explore sexuality, and even a sleep aid when your mind won't shut off. When it's approached with a healthy mindset, masturbation can support emotional well-being. And mental health, as we know, is deeply tied to physical health, including prostate function. Individual differences matter. It's important to say this too. Every man is different. Some men feel great masturbating every day. Others prefer a few times a week. Some not at all. Your genetics, age, hormone levels, emotional state, and lifestyle all influence how your body responds. What works for one guy won't always be right for another. That's why the best advice is always this. Pay attention to your own body. If something feels wrong, talk to a professional, but don't let shame or hearsay dictate your habits. Final thoughts. Should you masturbate every day? Here's the honest truth. If you're masturbating daily and it feels good, doesn't cause discomfort, and doesn't interfere with your life, there's no reason to stop. In fact, you might be doing your prostate a favor. On the flip side, if you're feeling sore, emotionally drained, or using masturbation to avoid other issues in life, it might be time to reevaluate your routine. The science is still evolving, but so far, the evidence leans in favor of moderate, regular ejaculation being good for your prostate, not harmful. You're not doing anything wrong. In fact, you may be supporting your health in a surprisingly simple way. Practical tips for prostate health beyond ejaculation. Let's quickly go over a few things that work together with regular ejaculation to support a healthy prostate. Exercise regularly, especially pelvic floor and cardio. Eat more tomatoes and greens. Lycopene and antioxidants are your allies. Stay hydrated. flushes toxins and supports urinary health. Limit alcohol and smoking. Both can harm prostate tissue over time. Don't ignore symptoms. Frequent urination, discomfort, or pain should always be checked. Let's normalize the conversation. For decades, men have been left in the dark when it comes to their own sexual and reproductive health. It's time to break the silence. Masturbation is not a dirty word, neither is prostate. The more we talk about this openly and honestly, the easier it becomes for men to care for themselves, ask questions, and get real answers. So if you've made it this far, good for you. You're taking ownership of your health, and that's something worth celebrating. In summary, daily masturbation is generally safe for most men. Research shows regular ejaculation may lower the risk of prostate cancer. It helps reduce inflammation and clear out harmful substances. There's no strong evidence that it causes prostate damage. Every man is different. Listen to your body and adjust accordingly. A healthy lifestyle plus regular ejaculation equals solid prostate care. If you found this helpful, consider sharing it with a friend or loved one who might benefit from hearing this. Let's build a future where men's health is talked about openly and where accurate information replaces outdated myths. Thanks for listening and take care of yourself. You deserve it.